Welcome back to Cancer Buzz. I'm your host, Summer Johnson. It's been a busy week here at the ACCC 39th Annual National Oncology Conference. And if you weren't able to attend this year, no need to fear. Cancer Buzz has been live from the conference all week, bringing you the conversations and headlines directly from the newsmakers. We're here right now with Erika DeBoer. She's the Chief Nursing Officer at the largest rural health system in the country, and that's Sanford Health. She's based in Sioux Falls, South Dakota. Hi, Erika.
Hi.
How are you?
I'm doing great.
It's good to see you. So today you are giving a presentation about using predictive modeling and analytics to optimize future staffing and scheduling decisions. Can you give us an overview of the challenges that you were seeing at Sanford Health?
Absolutely. So I think across the nation, all of us are experiencing challenges with our workforce. Doesn't matter if we're talking about our clinical teams or even our non-clinical teams. The amount of patients that need our support is expansive, and our traditional ways of doing things really aren't as effective as they could be. So using data and analytics as well as automating workflows, we've been able to optimize different ways of using our workforce so that they can focus their time and energy on taking care of patients.
What does that look like?
Well, you know what? It takes a lot of time and effort. We've got some brilliant people that I have the opportunity to work with at Sanford Health, including our data scientists and our enterprise data and analytics team, as well as our staffing and scheduling coordinators and the frontline teams. I always say the brilliance is at the bedside. And so when you think about a problem that we've needed to solve for a long time, if we ask them and we bring some potential solutions, they'll help us innovate and solve more problems. So the way that we talk about this is called LAMP. It's really that leveraging analytics to mobilize our staff and prepare for the future. So it's really a nod to Florence Nightingale as an innovator and really a mover and a shaker in her time. So what we tried to do was use the data that we have as well as the tools that we already have at our fingertips to just get smarter. So we use interfaces with our OneChart system or our Epic system, our scheduling system, and then we use our census data to actually help us anticipate what our workforce needs are on our inpatient units. If you think about that, it helps us standardize across our complex medical systems in our inpatient settings, but really the opportunities are well outside the walls of our hospital. It could help us with the staffing for our clinics when we think about our post-acute settings, as well as even when I think about the oncology space, what would it look like if we could have a better prediction of what our patients would need in those oncology infusion centers? How could we actually be more effective and efficient in using the brilliance of those clinicians in a different way? So it basically uses predictive analytics to help us actually understand how to effectively staff more appropriately, anticipate not only staff, but really the flow of patients through our system.
I would imagine that implementing something new throughout your workforce doesn't happen overnight. When did you start and how long has this been going on for?
Certainly doesn't happen overnight. We had an amazing, innovative group in one of our marketplaces that actually started well over 3 years ago. So we started small with that system, and they're effectively using each component of our LAMP tools. So it's not just about predicting, it's also about scheduling and then planning for our future. They're using all three of those. As we continue to roll the system out to each one of our different markets, it's really about managing change most effectively. So lots of conversations, lots of time and energy spent on what the value it is that it brings, as well as helping to manage change. Because although staffing and scheduling is just core to what we do every single day, sometimes changing that is really the most challenging part. And so applying technology, applying innovation has to come with a lot of relationships, a lot of collaboration to make it work.
Are you getting any feedback from the workforce?
We do. We get a ton of feedback from our frontline teams, and then we try to tweak the technology. We try to tweak the different tools to help meet the needs of our frontline teams. So that's been the biggest part of our success, is making sure that we're really addressing the questions and concerns from the frontline teams, and then continuing to push forward to make sure that they understand not only the why, but how is this actually helping them save time so they can get back to the work that's most valuable to them.
Are you able to track down to patient outcomes?
We're not able to track patient outcomes specifically yet, but some of the outcomes that we are looking at is what's their satisfaction. So how are we actually impacting our nursing satisfaction? Because if we have proper tools in place for planning and predicting what our patient needs and workforce needs would be, that means that we're going to be reaching out to those frontline teammates a lot less. We're trying to get proactive instead of reactive. So we're looking not only at workforce efficiencies, but also trying to figure out the best way to make sure that we're keeping the nurse at the center of this and making sure that they understand the important value that they bring to our patients every day. Automate, get rid of stupid stuff we always talk about, so growth. How do we get rid of some of those friction points to make sure that they can have joy back in their work?
That's a great ending statement. Thank you so much for stopping by, Erika. And thank you for following along with us all this week from the ACCC 39th Annual National Oncology Conference. Stay tuned right here for more great content and fresh perspectives on the latest news in cancer care. For the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.